So you will communicate the questions now. If there are questions from the audience, you will communicate.
Yes, ma'am. A very good evening to one and all. I am Arpita from the IGCP group. The topic that we have brought up today is early detection and screening protocols in cancer treatment. And yes, we have with us someone very eminent to address this topic, none other than Dr. Anita Malik, ma'am. Ma'am has done MBBS, MD in radiotherapy oncology. She is a radiation specialist oncologist and clinical lead at IOCI at Fortis Hospital, Noida. So, ma'am, with this very brief introduction of yours, I would now request you to please start with the PPT. Over to you, ma'am.
Okay, thank you so much, organizers, for inviting me in this talk related to awareness, cancer awareness. So I will be sharing the screen. So I hope my screen is visible to all.
Yes, ma'am. Please go ahead.
Okay, so the topic is early detection and screening protocols in cancer. So everybody should know that for all cancers, screening tests are not available. So for only very few cancers, the screening tested screening test, effective screening tests are available. So we will be first discussing the cancers in which we have screening test, and then later on the other cancers we will cover in this session. So we will talk about breast cancer, cervical cancer. These are the most commonest cancer in females. And what is breast cancer? What is cervical cancer? What causes? Because the risk factors, if we discuss that, so many of them they are modifiable, so we can reduce the risk. And how we can prevent that? Whether any measures, do we have any vaccine or any medicines from which we can prevent this? That we will discuss. So, what is cancer? When a cell divides uncontrolled way, and it spreads locally as well and to the distant organs. So then it converts into cancer, and these cells, the uncontrolled dividing cells, they no more serve the function from which they are originated. So suppose the kidney tumor, the kidney cells which are generating in the that tumor site, say they will not filter our blood. The lungs in which the tumor starts, if the cells divide, they will not filter our oxygen, they will not transmit the oxygen to our body tissues. So these cells are useless. So talking about the breast cancer, this is the most commonest cancer in the female, and this is second leading cause of death worldwide. Uh, is overall it is second most commonest, but in females it is the most commonest. And the incidence, when we define, is like in every 8 females, one will going to have this cancer, and because there is lifetime risk, so one is developing cancer among 8 females, and the incidence increasing. It is known to be a cancer of elderly females, but now we are seeing young patients too. So when looking after the anatomy, there is connective tissue, there are ducts which secrete milk, and there are connecting ducts. So cancer can arise from any of this part, from muscular part, from ducts, from glands. So most commonest is the IDC, intraductal carcinoma. So this is commonest, but other pathologies are also commonest depending on the origin of the cells, जहाँ से originate हुए वहाँ से. So what are the causes of breast cancer? The biology, what is the biology of cancer? So they, overall in all cancers there are certain changes happens in the DNA material, and the DNA material is the core material which controls the cell function, the cell growth, cell multiplication. So when changes occurs, and these changes are irreparable, and that is why there is the growth is uncontrolled. So sometimes these are due to viral infection, sometimes these are due to genetic changes, sometimes these are due to lifestyle changes, environmental changes. So we will be discussing this in this session. So when talking about the sign and symptoms of cancer, the patients, majority of them, they come to us with a symptom that is a lump, sometime indentation in the skin, means the retraction or eversion of the nipple. There may be misalignment of the nipple. There can be skin texture change. There can be change in the shape of the breast. So the obvious change which earlier was not there, and it is now, it is there over a very short interval, like in a week or in a month. These things come up. So in that case, one may have a suspicion of tumor or a malignancy. So being a females, they are at more risk. Although male breast cancer is also a known entity, but the risk, percentage risk, is less than 1%. So as I told, the aging is another risk factor. As the age increases, the woman gets older, and the chances of getting this cancer, having this cancer, is more. So genetic risk factors, 5 to 10% patients, they have the hereditary cause, maybe due to inherited mutation, due to which is coming from the family, other families. And another can be over the time the mutation happens in the DNA material. So this can be due to genetic. So 10 to 15% cases, they are gene related, maybe hereditary or sporadic cases. So what is familial cancer? The breast cancer risk increases in females in which their close blood relatives, they have the disease. So in that case, there are special recommendations to screen those population. Postmenopausal hormone therapy is another risk factors. The females, after their menopause, if they have symptoms, sometimes they are advised to take these hormone like diethylstilbestrol. These are hormonal things. So these should not be used for a longer time. There was one more study, one single study, which showed a positive correlation between use of hormonal contraceptives and breast cancer. So this should be avoided. Although only there was one study which correlates with this risk. So in some races like African American, women's incidents are more. The females which have dense breast, in those cases there is increased risk. Females not having child or having child in later age, so in that case it slightly increases the risk of having cancer. Patients with females with more menstrual cycle, means what does this mean? Females who have early menarche, means the menstruation onset age is less, and the menopause occurs late. In those females, they are subjected to more hormonal changes, because during the menstrual cycle the hormone changes, estrogen, progesterone, these hormone fluctuate. So these females, they are subjected to more hormonal changes for a longer period. So in those cases, it is observed that those females, they have more chances of having this. So breastfeeding is a protective. So not breastfeeding is that increases the risk of breast cancer. So physical activity, more active you are, the lower risk is. Obese patient, they have higher risk. So alcohol use is also increases the risk of going this cancer, increasing this cancer. So how to prevent this? We should be like stay healthy, be physically active. We should limit the alcohol use. Um, and we should think about like having child and breastfeeding, because these things are preventive. And minimal use of hormonal therapy, especially with the in postmenopausal females. There is no sure way to prevent this, but the only thing is we can reduce the risk. We can detect it early. That is why we gathered here. and we are discussing this, the early detection and prevention and screening. So next we will talk about the screening. What are the available screening tests for breast cancer? So screening tests, talking about this, first thing is the self breast clinical examination. Every female after the age of 20, after menstruation, maybe like after week or 10 days of stopping this menstruation, one can do a self examination, because at that time the breasts are soft and it is very easy to very easy to self examine that breast. So this screening, these methods then can detect the cancer in very early stage. So if some female, like somebody detects any abnormality, as like I discussed, any lump, misalignment of the nipple, skin retraction, nipple retraction, so in that case one can consult a physician. So the second thing is clinical breast examination, which can be done by a physician, by a gynecologist, a doctor. After that, if there is any abnormality, in that case the ultrasound or mammogram is recommended. For elderly females, what is recommendation is like after the age of 40-45, the mammogram, the x-ray mammogram is recommended. And in young patients, the ultrasound is the recommended test, because in young patients the breasts are dense. So how to do this self examination? While taking bath or changing clothes, you can see yourself in mirror by hands down or hands up, or on putting your hands on side. So you can examine your right breast with your left hand, flat fingers with the rotatory movements. And while sitting or lying down, you can examine this, squeeze your nipples and check whether there's a discharge or not, because discharge is another, can be another symptom, although it can happen in a pre-malignant conditions like dactylectasia, but you should see for discharge also. So a lot of videos are available on YouTube explaining how to do a self breast examination. You can go through those videos. So an average lump size that is found by breast self examination by a female is like a centimeter or 1.5 centimeter, and the clinician can detect it at a less than centimeter size. And the mammogram, we can detect it very early, like less than a half centimeter or a size. So as we see, the accuracy increases with the test, type of test, with the examination, we can detect it. So so what are the recommendations? As I told you, in every female after the age of 45 should go for a self uh, after this self examination, should go for a screening, breast screening, and that is the mammography. If the female is not having any lump or that, even in spite of that, she should go for this screening test. And once we detect something abnormal in the screening test, so these are the treatment options. Surgery may be minimal surgery if the lump size is small. It can be a mastectomy if the size of the ratio of the tumor to the breast is high. In that case, the breast has to be sacrificed. So other treatment options are radiation, chemotherapy, hormonal therapy, targeted therapy. It depends on the tumor size, tumor stage, what is the size, stage, and the hormonal profile of the tumor. So these are the treatment options, and these are advised according to the tumor type. So talking about the second most commonest cancer in females, that is cervical cancer. And yes, for this cancer also there is a screening test that we will discuss later in this part. So what is cervical cancer? The mouth of a uterus or a womb So that is known as cervical region. And if the cancer arises from that region, so that is known as cervical cancer. The most commonest type is squamous, but there are other histologies like adeno, small cell, clear cell. These are also known entities. This can be occur in the cervical region. So what are the commonest causes of this? Human papillomavirus, that is a known risk factor, then that can be transmitted from skin to skin contact or through sexual contact, can be a reason, a major culprit. But here one should remember that not all the HPV infected females will going to develop this cancer. Only the females in which this invasive infection happens, suppose in case of immunity or some patient with a HIV infection where immunity is less and the virus invades in the body, in those females only this cancer will going to happen. So there are other types of HPV infections also, so that can cause other conditions like genital warts, and these are related to cancer. So one should screen this HPV with a normal cervical cancer screening, that is the pap smear that we will discuss. And if the female is infected with the HPV, so those patients, they are, the screening should be more frequent in those cases. So yes, so that I discussed. Not getting screened, this is a main risk factor and one should avoid. So one should do this in females who are sexually exposed, married. They should undergo a pap smear screening test. So when the pap smear is combined with the DNA test, HPV DNA test, so the sensitivity of that screening test increases. And once the HPV infection is not there and the pap smear is normal, you can repeat it after 5 years. So cervical screening test is like we are detecting it very early, and that if we detect any cancer in early stage, the treatment options are very good. The outcome is very good, and moreover, the minimal surgery is required, and other treatments like chemotherapy, radiation, these things, these treatment measures should not, might not be required in those cases. So HPV along with pap smear, these are the recommended screening tests, as I told you. So what is pap? A test that collects cells from the surface of the cervix to check any abnormal cells. So in that we can detect abnormal cells as well as the cancerous cells. So there are certain pre-malignant conditions also. So we can detect this with pap smear. So what is HPV test? A test which collects cells from the surface of cervix to detect a HPV infection. Usually it detects the DNA, and that will help like whether the patient is at risk of developing cancer in future or not. So it's a kind of co-testing. So we are doing pap smear as well as HPV in same setting. So what are the recommendations? Women under the age of 21 should not be screened. Women in with the age of from 21 to 29 should be screened. When the pap smear is done, then every 3 years screening should be used. HPV test should not be used until unless needs a follow-up of abnormal PET skin. So PET. So if there is an abnormal PET, one should do for a PET HPV human papilloma virus screening in with that. When we start it at 30, it is preferred that we should do with the HPV test. So every 5 years, co-testing is recommended until the age of 65. So the cancer is 100% curable. It is true, but it is with few cancers. The other cancers, they have very poor prognosis. and by the virtue of their nature, like grade 4 brain tumor, stomach cancer, gallbladder cancer, these are poor cancer. Sometimes we see gallbladder cancer in screening test, and surgery is done, then chemotherapy is done, because in early, these are aggressive cases. So after surgery, other adjuvant therapy is also advised. So in this class, if you have any other questions regarding to other malignancies, we can discuss it here. So how to go back to the screen?
Yeah, ma'am. Thank you, ma'am. Thank you so much. Hello.
Hello, yeah.
Yeah, ma'am. Thank you. Thank you so much for the presentation, ma'am. Can we move on to the questions now?
Yeah, please.
Okay, okay, ma'am. Just give me 1 minute. Ma'am, first question is, are there any specific cancers where early detection has an especially high impact?
Yeah, so the one of the commonest is the breast cancer. If we detect it early, the incidence is so high, it is increasing. Earlier it was cervical cancer, now it is breast cancer, especially in the urban females. So if we detect it, screen detection, in the case of screen detection, we can detect it early, less than a centimeter size or a millimeter size. In those cases, only surgery is the option. So we can save the breast. So because larger tumors, the whole breast is removed. So if the tumor size is less than a centimeter size, many times the chemotherapy you can avoid. So this is, with the cancer screening, we are avoiding the morbidity. So that is why it is important here.
All right, ma'am. Next question is, how should a patient decide which screenings are necessary for them?
Yeah, so it is according to the age. So as I told you, after the age of 40, 45, every female should go for this test, whether if she is not feeling any lump or so. Asymptomatic patients should go. And in the patients who have a family history of breast cancer, they should do it early, 5 years early. Like suppose a patient, a female mother or a nanny or a grandmother has this. So if the age is 50, should go for start screening at the age of 45. If she had this at the age of 40, one should go for a screening at the age of 35. So 5 years early, before that. And if a female have a breast cancer in the age of less than 50, the genetic testing is also advised, and with a proper counseling, genetic counseling, because there is an implication if someone comes positive with this BRCA gene. So we have to explain what are the measures should take, how the rest of the family members should screen. So there are recommendations accordingly.
Right, ma'am. Thank you so much for answering this query. That was one from our audience. Next question is, with advancement in technology, just a minute, ma'am. With advancement in technology, how have screening methods improved for detecting cancer at an early stage?
Yeah. So with the advancement of technology, like we have now digital X-rays, mammography, the quality has improved. If suppose we have any suspicious lesion which we are not sure, very small, we cannot track for a biopsy. In that case, MRI is recommended, especially in patients, young patients, where the ultrasound or a mammography, they're not able to characterize the lesion. So in that case, contrast MRI is advised. So they increases the accuracy. these technology, these newer treatment options, these newer imaging modalities, they increases the accuracy. Same with the treatment also. So we are not at all talking about the chemotherapy, but the other like immuno-targeted therapies, we are also talking about these, because these are newer treatment modalities, and we are expecting a life expectancy is increased with these treatments. So the imaging modality, the treatment modality, that has improved. Now what is lacking, where is the gap, is the awareness. So that is why we are gathered here.
Right, ma'am. There is one last question. Ma'am, for patients in remission, what screening protocols are recommended to monitor for reoccurrence?
Okay, so you are talking about the patient once is treated and cured, right? So in that case, when we see a cancer patient already treated, completed the treatment, so maximum risk when we see is in within the 2 years. That cancer can come again in 2 years. So as the time passes, the chances of coming back is less. So after 5 years, it is even less than that. So the follow-up and the repeat diagnostic test, evaluation, follow-up test, so the duration increases as the time passes. So initial 2 years, what is recommended is that you should do initial first year a clinical examination every 3 months, diagnostic test or MRI or CT scan or a PET scan in 3 months, first test, then 6 months, up to 2 years, then yearly test. So as the time passes, the screening frequency, advising these tests, follow-up tests, it increases. And after 5 years, we say like you are cancer free. Just in a year, you have to say hello to us. Everything, if everything is fine, then you can like label it like the patient is cancer free.
Right, ma'am. So these were all the questions for today, ma'am. With that, I would like to conclude the session. But before that, I would like to thank you from like bottom of my heart for taking out time, for putting all your effort for making the presentation, and for solving all the queries from audiences. So thank you so much, ma'am, for your time, for your effort, and everything. Thank you so much once again.
Thank you.
Thanks to all the audiences for connecting with us and for putting up their questions. Thank you all. See you for the next time. Thank you.
Thank you. Thank you.